Hi, welcome to this session of Antiarrhythmic Drugs. I'm Dr. Ahmed Khan from School of Pharmacy, Dehradun. In the previous session, we have discussed about the cardiac conduction system, how it works, and the electrophysiology of the cardiac system. We have also discussed the classification of the antiarrhythmic drugs, which are class 1, class 2, class 3 and class 4, and which is classification is based on the mechanism of action. We have discussed the class 1 drug, which are really the membrane dependent drug, and these antiarrhythmic drugs of this class 1 actually they have the stabilizing properties, and they shift the membrane more negative towards the more negative potential. And this class of drug they act on the fast sodium channel blockers by the process of depolarizing charges. Now we have discussed some of the drugs in this category like quinidine, disopyramide, procainamide. Now there are some more drugs which we are going to discuss today. Very important property which we want to just share with you, that the action of these class 1 antiarrhythmic, because they are the local anesthetic type antiarrhythmic, so they are pH dependent and they vary with each drugs like quinidine and procainamide, Lidocaine, etc. These antiarrhythmic drugs are very weak bases, and the most having the pKa value ranging from 7.5 to around 9.5. Now under this category of the class 1, the next is phenytoin. This phenytoin, it exists in the salt form of phenytoin sodium. This is the IUPAC name of the phenytoin, and this is used for past so many decades. Actually, it is used in control of the grand mal types of epileptic seizures. If you see the structure of this molecule, it looks that it is an analog to the barbiturates, but actually this does not possess their extensive sedative properties. So, and the compound is available as a sodium salt. The solute or the parenteral administration of sodium, it contains around 40% of the propylene glycol and 10% alcohol to dissolve the sodium salt. This is required for the phenytoin sodium injections. If you see this structure of the phenytoin belongs to phenylhydantoin. These phenylhydantoin, they are the heterocyclic aromatic compound which contain the imidazolidine diones moiety, which is substituted by a phenyl group. This phenytoin sodium having the cardiovascular effect, actually it was having the toxic manifestation of the drug, and in patient being which is treated for the seizure disorder, but it has having the effect for the bradycardia, so it was chosen as a serendipity and having a prolonged PR intervals and produce the T waves abnormalities on the electrocardiograms. This phenytoin sodium having the greatest clinical use as an antiarrhythmic drug, basically especially in the treatment of the digitalis induced arrhythmias. Very important point to be noted is that the action of phenytoin is similar to that of the lidocaine. It suppresses the ventricular automaticity produced by the digitalis. This phenytoin is sodium is useful in the supraventricular tachycardia which are caused by the digitalis intoxication. So overall, it is used in the treatment of the digitalis induced arrhythmias. Now the next drug is Maxillatine. This Maxillatine hydrochloride, this is the IUPAC name, and it belongs to the class 1B, and this is very effective when given intravenously or orally. It resembles with the Lidocaine in possessing the xylyl moiety, but it is different chemically than the Lidocaine. It is similar to the Lidocaine in a xylyl moiety, and it is different, but otherwise it is very different than the Lidocaine. When this Maxillatine it gets metabolized, its metabolite like para-hydroxymaxillatine and hydroxymethyl-maxillatine, they are not pharmacologically active. They become inactive. They are metabolites. The Maxillatine hydrochloride, like the which is a part of the class 1 antiarrhythmic, it blocks the fast sodium channels in the cardiac cells, and especially it is very effective on the Purkinje fiber in the heart. This Maxillatine hydrochloride is used for long-term oral prophylaxis of the ventricular tachycardia. If we talk about the chemical taxonomy of this Maxillatine, basically it's a compound which belongs to the phenol having containing substituted with the benzene ring. So the superclass is benzenoids and the class is phenols, and overall we can say that it is an aromatic homomonocyclic compound which has having the aromatic ether or primary amino compounds. Now the next compound is Tocainide. This Tocainide hydrochloride this is the IUPAC name, and it is an analog of Lidocaine. It is very active orally, and it also has the electrophysiological property like those of the Lidocaine, as because it is an analog of the Lidocaine. The drug is only differ with from the Lidocaine as it lacks 2 ethyl groups which provide the Tocainide hydrochloride some protection. These 2 ethyl groups in the Tocainide hydrochloride, it gives a protection from the first pass hepatic elimination. When this Tocainide it get orally ingested, so these 2 methyl groups they help the Tocainide from the first pass hepatic elimination. This Tocainide hydrochloride is elimination after the oral injection, and it is basically hydrolyzed in a manner similar to that of also Lidocaine, but none of its metabolite is active. Now this Tocainide it is one antiarrhythmic agent and used orally to prevent or to treat the ventricular ectopy and the tachycardia. Now if we see the structure of this so it belongs to a compound which are the xylenes. So these are the aromatic compounds that contain the metaxylene, which is a monocyclic benzene carrying the exactly 2 methyl groups at 1 and 3rd position. Now next compound is the Lidocaine. as we have talking about this lidocaine for so many times. So now let's talk about the lidocaine. We are just taking the name of the lidocaine. Now the lidocaine, we are talking about the lidocaine, which is a very important drug. This is the IUPAC name of the lidocaine, and it is a derivative of the gramine, which is the 3-diamino-methyl. So it was actually introduced as a local anesthetic, and being intravenously as a standard agent for the suppression of the, which is actually associated with the acute myocardial infarction and the cardiac surgery, because it has the local properties. So this drug is of choice for the parenteral treatment of premature ventricular contraction. This is the structure of lidocaine, and it belongs to the 1B class of the antiarrhythmic agent, and it has a very different effect on the biological property of the myocardial cells from that of procainamide and the quinidine. So like tokenide, which is an analog of this lidocaine, is because that tokenide belongs to a class of the organic compound having the amxillines. In the same way, because it's an analog of lidocaine, so lidocaine also belongs to a class of drug which contains the amxilline, and this amxilline is the monocyclic benzene, which carrying exact 2 methyl group at 1 and 3 position. So the classes and the subclasses, especially the direct parent is xylene.